The CLR Port Injector is used to instill or sample fluids using the CLR port. The provider simply twists the Luer lock syringe onto the port injector. Next, the access cap is removed from the port and placed in a sterile location. The provider then inserts the port injector. Doing so will automatically cut off flow to the drainage system to allow for installation or sampling through the syringe. If the instilled fluid needs to dwell within the body cavity, the indwelling catheter may be clamped. Once the procedure is complete, the provider removes the port injector and inserts a sterile access cap into the port. If a new, sterile access cap is not available, the provider may reinsert the original access cap, which has been stored in a sterile location. When it comes to lavage, the solution is clear.